Pneumococci or Streptococcus pneumoniae. Streptococcus pneumoniae is also known as pneumococcus. It is genetically related to Streptococcus and it shares a common cell wall polysaccharide antigen with Streptococci. It is also known as Diplococcus pneumoniae. It's a normal commensal of the upper respiratory tract. The upper respiratory tract में pneumococcus they occur naturally in the human beings. So it is a commensal in the human body as well as it can also act as a pathogen in the human body. Morphologically, Streptococcus pneumoniae, they are gram-positive cocci, 1 micrometer in dimension. They are flame-shaped or lanceolate-shaped, and they occur in pairs with the broad ends in apposition. The capsule, there is a common capsule which surrounds each pair, and in old culture, the capsule is lost. Pneumococci, they are non-motile and non-sporing. So remember, important morphological feature of pneumococcus is that they are flame-shaped or lanceolate-shaped and they occur in pair, and the entire pair is surrounded by a common capsule. This is a figure which shows gram stain in the pus cells can be seen, and pneumococci can be seen in the tissue smears. Pneumococci occurring in pairs and they are flame-shaped or lanceolate-shaped. This is another figure which shows gram-positive Diplococcus surrounded by a capsule, and if you observe quite carefully you can appreciate the flame shape or the lanceolate shape. Growing for culture, pneumococci, aerobes and facultative anaerobes, 5 to 10% CO2 favors their growth. They can grow at 37 degrees Celsius. They have complex nutritional requirements. They grow only in enriched media, especially when it is supplemented by whole or defibrinated blood. Besides, brain heart infusion agar or Triptychus soy agar can also be used for pneumococcus. Pneumococci, they are alpha hemolytic, and colonies on blood agar after overnight incubation are usually raised, circular, and about 0.5 to 1 millimeter in dimension. They are surrounded by a zone of alpha hemolysis. In prolonged incubation, pneumococci they undergo autolysis because of an autolytic amidase, which leads to lysis of the colonies. In about 2 to 3 days, the colonies of pneumococcus they automatically get lysed, and because of this autolysis, the central area has a depression in the colony, which creates a typical Draughtsman appearance or carom coin appearance. It is known as carom coin appearance or Draughtsman appearance. The capsulated bacteria initially, in the young colonies, they are smooth. The colonies are smooth, and as time passes, the colonies become old, they become rough. As the bacteria, they start losing their capsule, and this variation from smooth to rough is known as SR variation. Hemolysis and Draughtsman colonies of Streptococcus pneumonia are shown here. Alpha hemolysis, which is greenish discoloration because of partial hemolysis, and colonies of pneumococcus are Draughtsman or carom coin in appearance. Biochemical reactions of Streptococcus pneumoniae, they ferment a variety of sugars producing large amount of lactic acid. Sugar fermentation test is carried out in his serum broth. Inulin fermentation test is important feature for pneumococcus. It is positive in case of pneumococcus, while it is negative in several other streptococci. They are catalase negative and oxidase negative. Besides inulin fermentation test, another test known as bile solubility is a feature of pneumococcus. In bile solubility test, bile solution is taken, sodium deoxycholate solution, and it is added to the culture, and the bile gets dissolved. The colony gets dissolved in the bile solution. This is called bile solubility test, and it is positive in case of pneumococcus, while it is negative in case of other streptococci. The enzyme autolysin, that is N-acetyl-muramyl L-alanine amidase, produced by pneumococcus, it solubilizes the peptidoglycan of the cell wall, which leads to autolysis, because of which the pneumococcus gets dissolved in bile. Bile solubility test, स्ट्रेप्टोकोकस माइटिस में नेगेटिव है, उसमें लाइसिस नहीं हुआ बाइल से, लेकिन स्ट्रेप्टोकोकस निमोनिया में लाइसिस हो गया बिकॉज ऑफ द ऑटोलाइटिक एमिडेज एंजाइम. Sensitivity to optochin is another feature of pneumococcus. Pneumococci are sensitive to optogene. Optogene is also known as ethyl hydrocuprin hydrochloride, which is an alkaloid related to quinine. Optogene sensitivity is another characteristic feature of pneumococcus. So inulin fermentation, bile solubility, and optogene sensitivity are important characteristic features of pneumococcus. Here in this photograph, optogene sensitivity of pneumococcus is shown, while other streptococci, they are not optogene sensitive. Antigenic structure of pneumococcus include capsular polysaccharide, somatic M protein, cell wall carbohydrate. Various antigens and various proteins of the organism can be depicted in a pictorial manner like this. The capsular polysaccharide of pneumococcus is type-specific. It is immunologically distinct for each of the 90 serotypes. It elicits B cell response. And the capsule of the pneumococcus is also known as specific soluble substance, as it is soluble in tissue and culture fluids. It diffuses into culture media or infective exudates and tissues. Serological typing of pneumococcus is only of epidemiological importance. There are 3 typing methods: agglutination test, precipitation test, and Quilling reaction. What is Quilling reaction? In Quilling reaction, when a suspension of encapsulated pneumococci is mixed on a slide with a drop of specific antiserum and a loop full of methylene blue, the capsule around pneumococci, it reacts with its antiserum, and because of that reaction it gets swollen, and this swollen capsule, because of methylene blue, it can be seen distinctly, and this kind of reaction in which the capsule of pneumococcus is seen as a swollen structure is known as Quilling test. Quilling reaction positive. This test can be performed either in the sputum or in the culture. Here you can see the photograph of Quilling test. The pneumococcal capsule has swollen because of the antiserum being added, and the swollen capsule is Quilling test reaction. Besides that, somatic M protein are also there. Then cell wall carbohydrate antigens are there in case of pneumococcus. Then another substance known as C-reactive protein, which precipitates serum globulin fraction, called C-reactive protein. It is basically an acute phase protein, and it was believed that this C-reactive protein is an antibody against the capsule of pneumococcus, and from that it got the name C-reactive protein. But later on it was found that it is not antibody to the pneumococcal capsule, but it is an independent entity which is found in the blood, and it just merely reacts with the capsule of pneumococcus. This C-reactive protein is an acute phase protein. It is produced by hepatocytes, and under normal conditions its concentration remains low in the blood. Under certain conditions of inflammation and stress, the C-reactive protein value increases in malignancies, in bacterial infections and tissue destruction, etc. In many variety of conditions, C-reactive protein value increases rapidly, and it also declines as the patient recovers. So C-reactive protein test has been used as a prognostic marker for various disease conditions. CRP test has also been used for this coronavirus infection as a prognostic marker. C-reactive protein test can be done as a latex agglutination test. CRP test done by latex agglutination method. Virulence factors of pneumococci also include the polysaccharide capsule, which is antiphagocytic, and the IgA protease, which inactivates secretory IgA antibodies, the protein adhesin, which has a role in colonization of oropharynx, the cell wall constituents, teichoic acid and peptidoglycan, the pneumolysine, the H2O2 produced by pneumococcus. The various virulence factors of pneumococcus can be shown in the diagrammatic manner like this in a single slide. In animal pathogenicity, pneumococcus, 2 animals are used, mice and rabbit. Mice is the most common animal used for pneumococcus. So remember that experimental animal for pneumococcus is mice. Animal dies in 1 to 3 days, and organism can be found in peritoneal exudate and heart blood in large numbers. Clinical syndromes caused by pneumococcus include lobar pneumonia, otitis media, sinusitis, meningitis and septicemia. Lobar pneumonia otitis media, sinusitis, septicemia. And various serotypes of pneumococcus, they cause infections in different categories. In adults, type 1 to 12 are common. In children, type 6, 14, 19 and 23 are common. The invasive types of pneumococcus are type 1, 3, 7, 8 and 12, which lead to serious infections, and the most virulent serotype of pneumococcus is type 3. Streptococcus pneumoniae is a strict parasite and is not found in the environment. It is a member of the normal resident flora of the human being's upper respiratory tract. And healthy people also carry Streptococcus pneumoniae in their throat. Predisposing factors for pneumococcal infection include abnormalities of the respiratory tract and impaired immune responses and loss of splenic function consequent to splenectomy or asplenia, congenital asplenia or sickle cell anemia. So patients with splenectomy or asplenia, they are more predisposed to pneumococcal infections. Streptococcus pneumoniae causes pneumonia, and besides Streptococcus pneumoniae, there are several other bacterial causes of pneumonia like Staphylococcus aureus, Klebsiella pneumoniae, Streptococcus pyogenes, Haemophilus influenza, Fusobacteria, bacteroids, and anaerobic cocci. Bacterial causes of meningitis include Neisseria meningitidis, Streptococcus pneumoniae, H. influenza, Streptococcus epileptiae, Listeria monocytogenes. And for laboratory diagnosis of pneumococcal infections, which specimen will be taken depending on the type of lesion, sputum, pleural exudate, blood or spinal fluid, etc. Which microscopy? So we can do gram stain, in which you can see flame shape or lanceolate shaped diplococci with capsule surrounding them, and quilling test can be done for the capsule. Biochemical test may inulin, optochin and bile solubility. Culture media may blood agar, chocolate agar. Type of colony, Drotsman appearance or carom coin appearance. CRP-AC, reactive protein and acute phage protein, which is used as a prognostic marker for many disease conditions. Experimental animals used for pneumococcus, mice and rabbit. The relation of spleen with pneumococcus. स्प्लीनेक्टॉमी या एस्प्लीनिया वाले कंडीशंस में न्यूमोकोकल इन्फेक्शन का रिस्क काफ़ी बढ़ जाता है. प्रोफाइलैक्सिस में न्यूमोकोकल वैक्सीन्स आर देयर विच प्रोटेक्ट अगेंस्ट द स्ट्रेप्टोकोकस निमोनिया बैक्टीरिया दैट कैन कॉज meningitis and pneumonia. Various category of people which require vaccination include patients with sickle cell anemia, nephrotic syndrome with functional or anatomical asplenia, those with hepatic cirrhosis, chronic renal failure, chronic cardiopulmonary disease and organ transplantation. Various pneumococcal vaccines are available in the market: bivalent, trivalent, pentavalent, heptavalent, 23-valent vaccines. So different types of vaccines are available, and for different regions which serotypes are prevalent in that region, accordingly that kind of vaccines are recommended. And that finishes the topic. Thank you.